If you've been told that you have high cholesterol, then you probably have a lot of questions on your mind. What is high cholesterol? How did I get it? What can it do to me, and how will it affect my life?
The good news is that you're taking the first step towards dealing with high cholesterol. This presentation will tell you what cholesterol is, how high cholesterol affects your body, how it is diagnosed, and what you can do about it. And the first thing you should know is that you are not alone. About 40 million American adults have high cholesterol. You will soon have the information you need to get high cholesterol under control and move towards a healthier future.
Cholesterol is a type of fat found in all of your body's cells. Your body needs cholesterol to work properly. In order to get to all of your cells, cholesterol needs to travel through the bloodstream. Proteins form a shell around the cholesterol, making a cholesterol complex. It is then released into the bloodstream and travels to where it needs to go. A protein that is linked to cholesterol is called a lipoprotein. You have probably heard about good cholesterol and bad cholesterol. The cholesterol complex, or lipoprotein, that can be bad is called LDL. LDL stands for low-density lipoprotein. Normally, LDLs transport cholesterol from your liver and deliver it to the tissues that need it. But if you have a lot of LDLs left over after all of your tissues have been taken care of, the LDLs will let go of the extra cholesterol while traveling through your blood. The good lipoprotein, which is also the good cholesterol, is called HDL. HDL stands for high-density lipoprotein. HDL is good because it picks up the extra cholesterol that was dropped off by the LDLs. This is why it is good to have high levels of HDL in your system and low levels of LDL. Think of H for high to help you remember this about HDL. And L stands for low, which is a way to remember that you want low levels of LDL.
Cholesterol comes from two places. Your body makes most of the cholesterol it needs in the liver. The rest of the cholesterol in your body comes from the food you eat. There is no cholesterol in anything that comes from a plant. Cholesterol is only made by animals, so you can only get it by eating animal products. It is very important for you to have good cholesterol levels in your body. This is because your body uses cholesterol to hold cells together, and also it uses it to make important hormones that allow your body to work properly. Let's go over how the body makes sure that your levels are good. The body has a gauge to measure the total cholesterol in your blood. If you are healthy, the more cholesterol you eat, the less cholesterol your body will make. If you eat less cholesterol, your body will make more. This allows your body to keep the cholesterol at the proper level. Even if you never ate any cholesterol, your body would still make enough. However, everyone's gauge works a little differently, and this is largely due to your family history. Some people have a gauge that works very well, meaning that it is sensitive to the cholesterol levels in the body. If you have a good gauge, you can eat a diet that is higher in cholesterol, and your body can still maintain a proper blood cholesterol level. Others, who have a less sensitive gauge, will find it harder to regulate the cholesterol level in their blood. Even if you try to eat a diet that is lower in cholesterol, you may still have difficulty keeping your blood cholesterol at a healthy level.
For most people, their internal cholesterol gauge works well enough to keep their cholesterol at a good level. However, if your levels of cholesterol are too high, LDLs will leave extra cholesterol in the blood. If the HDLs cannot pick up all of this cholesterol, it will begin to build up on your artery walls, along with other fats and debris. This buildup is called plaque. Over time, plaque can narrow the blood vessels, and sometimes this buildup may even block your blood vessels completely. Plaque buildup on your blood vessel walls is called atherosclerosis. A narrowed or blocked blood vessel can prevent blood from getting to where it needs to go. If the blocked vessel is in your brain, it can cause a stroke. Blockages can also happen in the blood vessels called the coronary arteries that carry blood to the heart muscle. This blockage process is called coronary heart disease, and the end result can be a heart attack.
So, how do you get high cholesterol? Unfortunately, most of the time, there's no specific answer to that question. However, if high cholesterol or a less sensitive cholesterol gauge runs in your family, there's a pretty good chance that you may have it too. You are also at risk if you eat foods high in fat and cholesterol, smoke, drink too much alcohol, don't exercise, or have diabetes. Increasing age can also increase your chance of having high cholesterol.
The only way to find out if you have high cholesterol is to have a blood test. You can have high cholesterol for many years without feeling its effects. In fact, most people with high cholesterol feel no different than those without it. If you are 19 or older, then you should have a cholesterol test once every 5 years. But if you are already at risk for heart disease, your medical professional will probably wish to look at your situation more closely. The more risk factors for heart disease you have, the lower your cholesterol needs to be. In fact, if you are over the age of 55 for men and 65 for women, or if an immediate family member died of heart disease before those ages, if you use tobacco products, have high blood pressure, have diabetes, are overweight, and/or lead an inactive lifestyle, your healthcare provider will likely recommend treatment for you at a lower cholesterol level than someone who doesn't have any heart disease risk factors.
Treatment for high cholesterol is an important issue for anyone's general health. If you have high cholesterol, you will need to take steps to fight it every day, just like you would brush your teeth to fight gum disease. For most people, living with high cholesterol is a lifelong journey. It can take decades for high cholesterol to have a bad effect on your health, although it still does damage even when you don't have or notice any symptoms. If you have high cholesterol and nothing is done to lower it, then you will be more at risk for serious medical problems later, such as a heart attack or stroke. If changes in your diet, exercise, and weight loss don't help lower your cholesterol level, your doctor might prescribe medication. Your doctor will base his or her decision to give you medication on more than just the cholesterol blood test. They will also look to see if you are at risk for heart disease from other problems. The more risk factors of getting heart disease you have, the lower your cholesterol level needs to be. There are many types of medications used to treat high cholesterol. The type your doctor recommends will be based on many things, like your cholesterol levels and other medical conditions. Remember that high cholesterol cannot be cured, but it may be controlled, and your cholesterol level is likely to creep up again if you stop treatment. That's why it's important to maintain a healthy lifestyle and take your medication every day, even if you feel fine. For most people, taking cholesterol-lowering medication is a lifelong commitment. As you have seen from this presentation, cholesterol is not a bad thing. It does serve a very important purpose in keeping the body healthy. Unfortunately, some people who have high cholesterol choose to ignore it because there are no obvious symptoms. Having high levels of cholesterol for long periods of time can greatly increase your risk of serious medical problems like heart disease, a stroke, atherosclerosis, and other heart and blood vessel problems.
Even though it is a serious problem, commitment and care from you and your healthcare providers can help control high cholesterol. You now have a lot of information about this condition, which includes treatments such as making lifestyle changes and possibly taking medication. Whatever the approach you take or the condition you're in, making a lifelong commitment to lower your high cholesterol is a very worthy goal.